Dr. Eric Rosenberger at Facial Focus Cosmetic Surgery. Today we're going to be doing a PRP and microneedling session for beard restoration. This patient has a adequate beard growth and a triangular distribution, a devoid area of hair, an area of hair growth in the goatee distribution with a lack of hair in the midline. What we're going to do at each areas that we've marked in red is place a small amount of PRP and stimulate follicle growth. I'm going to do a blood draw for PRP harvest. Excellent vascularity, so it should represent a good and efficient harvest. We've got our butterfly needle, and we've got some anticoagulant in our syringe, so we all primed here.
All right, I'm gonna give you a stick.
Poke.
I'm just gonna hold it there. It's gonna take a minute. Let me know if you're doing all right. Doing okay?
Yep.
Okay.
Get our next one on there. So, relatively painless procedure to harvest 40 ml of blood. This should provide a minimum of 10 cc's of platelet-rich plasma. We've done one spin. This was completely filled with whole blood after one round of centrifugation. You've got a platelet-poor plasma here in the top. You can see this buffy coat of the platelet-rich plasma that's we're interested in, and then further compressing of the red blood cells in the lower part of this kit. I'm going to mix these samples. A little bit of pink is okay. Just means we have a little bit of red blood cell contamination. Okay, and that's it. It's ready to inject. Okay, this is Dr. Rosenberger with Facial Focus Cosmetic Surgery. We're about halfway through placement of platelet-rich plasma in an area of beard growth and lack of growth. So right here, we're going to be injecting into the dermis, and this is the border of where beard hair is growing and where it's not. We're going to start stimulating these follicles. And what you'll see as we place this is a little blanching, and then that's going to be followed by a uniform kind of pinkness, a little erythematous hue as the platelets start getting activated, which will continue after we do the microneedling. Okay, so we can see here this area of erythema. This is where we placed our PRP and where we didn't. Okay, we're going to keep moving in this line, and you can see where we've kind of fanned the PRP within the area of growth that's already happening. Okay, so we're going to start the microneedling process. Actually, we already did one pass at 0.25 millimeters. You can see where we've crossed up to the midline, back and down. Now we're going to reverse the pattern to perpendicular to where we just went. It's going to go a little bit deeper. What we're looking for is a pinpoint, just some pinpoint bleeding. We just concluded the microneedling portion. Our endpoint is this fine little pinpoint bleeding that we can see here. Next step is we're just going to apply one more pass, and at the same time we're going to apply some platelet-poor plasma essentially as a dressing over the wound. You take that. We have just completed a PRP therapy for beard generation. You can see a little bit of blanching here from the numbing injections. Mainly we have a uniform pink erythema from basically the angle of the mandible to the angle of the mandible, the submental area, and the area underneath the lower lip. 15 cc's of platelet-rich plasma were injected intradermally, and next several passes with a skin pin microneedling were performed, followed by application of platelet pleuroplasma as a dressing. And this is the conclusion of the procedure. Thank you.